Welcome to Webinar Wednesday. We're glad to have you with us for today's presentation featuring experts Stephanie Andersen, Managing Partner of ZulaFly, and Sandra Rasmussen, Senior Vice President, Sales and Marketing of Sonitor, as they discuss the value add of an RTLS system within behavioral health facilities, specifically on the topic of staff safety. Details on the importance of location accuracy, how alerts are administered, and analytics will be thoroughly covered during this course. Webinar Wednesday would like to thank our sponsors, Sonitor and ZulaFly. Sonitor is the leading developer of unique ultrasound technology that locates people and items in real time with the most reliable, high-definition accuracy within complex indoor environments. Their mission is to deliver the most accurate and reliable indoor positioning technology to improve the quality of life. For more information, please visit sonitor.com. ZulaFly, a leading platform and software application, provides staff safety, asset management, environmental monitoring, workflow, staff rounding, and analytics. ZulaFly offers cloud-hosted or on-site deployments so that customers can get up and running right away with their solution. User-friendly dashboards help staff ramp up quickly, and automated alerts help staff provide the best care possible. For more information, please visit zulafly.com. A few announcements before we get started. Don't miss our 20th anniversary celebration at MD Expo in Atlanta next month, April 11th through the 13th. MD Expo strives to provide healthcare technology management professionals with a unique, intimate, and rewarding conference second to none. You can find all the details and registration at mdexposhow.com. We will hold a live Q&A at the end of today's webinar. If you'd like to ask a question, please use the questions feature on the webinar dashboard. We'll get to as many attendee questions as time allows. As I mentioned earlier, our speakers today are Stephanie Andersen and Sandra Rasmussen. Sandra, you may begin whenever you are ready.
Great, thank you, Jennifer. Thank you, Technation, for giving us this opportunity. We're really excited to be here. So as Jennifer said, today we're going to be talking about real-time location systems, and I know we've often spent time talking about real-time location systems, but today we're going to talk about it in the context of behavioral health and the value that automating panic buttons and workflows can really bring to behavioral health settings. As Jennifer said, I'm joined here today with my colleague and partner, Stephanie Andersen, and together we're really going to demonstrate the value RTLS can bring to staff safety in particular, but we'll also have the opportunity to share how an RTLS solution, once implemented, can bring value across a wide variety of use cases. Let's talk a little bit about the healthcare environment and specifically how it relates to challenges that caregivers face as a result of the extreme pressure that they're put under on a day-to-day basis. It's hard to believe that it was 2 years ago, maybe not today, but certainly within the March timeframe, that we were also significantly impacted by COVID. And over these past 2 years, the healthcare environment has really been put under a significant amount of stress to be able to deliver quality care in a timely fashion to patients across the board, not just COVID-related patients. And prior to COVID even, it was a well-known fact that healthcare environments are often under stressful situations that can often cause and threaten our healthcare givers. Many healthcare providers claim that they've been victims of workplace violence, sometimes associated with either patients or families that are under stress and have triggered events that might put caregivers in potential harm's way. This was happening even prior to COVID. So with the associated challenges or the added challenges that are associated with providing care during COVID, reports have shown that there have been a 25% increase in the prevalence of anxiety and stress in the general population. And this is putting our healthcare providers at even more risk. As a result, many hospitals and behavioral health facilities have found themselves asking for federal support for technologies such as panic buttons and other things that can help ensure a safe environment for their staff, but also a safe environment for their patients. It's already hard to be in healthcare when you're dealing with patients that are already sick and are already stressed. And so with many hospitals experiencing staffing shortages across all departments and functions, you can imagine how stressful it is if, in addition to all of that, you're also feeling threatened on the job. Many studies show that the rate of violent incidences have more than doubled during the pandemic. This is adding not just stress to healthcare providers, but also adding to a turnover rate within healthcare that can also add to expense in terms of replacing staff or covering shifts, covering medical expenses, for example, if staff are injured. Behavioral health environments share these same concerns, and with patients feeling either anxious or depressed and staff under a lot of pressure, it doesn't take a lot to trigger people in general. So staff really need to be equipped with the right tools to not only make them feel safe, but also to ensure they have immediate access to help when they feel they are in a threatening situation. Patients in behavioral health environments also need access to help if they feel triggers that might escalate their behavior. Not only can technologies provide a more safe environment, but technologies are also needed to help alleviate pain points in workflow, so staff aren't overburdened with administrative or manual tasks and can spend more time with their patients. So today we're going to talk about RTLS technology and how RTLS can help create these safer environments, help automate workflows that can eliminate manual burdens that can also then eventually help reduce stress. So how can RTLS help create safer and more efficient environments in behavioral health? Well, first and foremost, staff members can be equipped with panic buttons that can be used to quickly and discreetly alert when they're in threatening situations. And as a result of RTLS, their position can be pinpointed accurately so that people can get to them to help them in situations where they might need help. From a patient standpoint, patients can be provided wearables with buttons that can allow them to press a button if they feel a trigger that might create an environment that they no longer feel safe in, or an environment that potentially is going to escalate stress and anxiety. And then on the workflow side, through location-based technologies such as RTLS, workflows can be automated, such as rounding, that eliminate the need for staff then to manually document the activity or the visibility that they've provided with a patient during a routine rounding scenario, which in behavioral health environments can often be on a 15-minute basis. So let's talk a little bit about RTLS. I mentioned that staff can be equipped with badges that allow them easy and discreet access to panic buttons that can be pressed to then alert to responders that they're in need of help. And as a result of RTLS, their exact location can be communicated to the emergency responders so that they can get right where they need to be without having to guess where that staff member might be. The locationing and positioning technology that is enabled through RTLS is what provides this accurate pinpoint with real-time updates, letting people know exactly where people are in the minute, not just minute, in the second that that button gets pressed. And as I mentioned, based on location and presence, workflows can be automated such that staff members don't need to manually input the fact that they've completed their rounding activity. So I know I've spent a fair amount of time with technician members to describe how RTLS works, but just as a refresher for those who may be new to RTLS, RTLS stands for Real-Time Location System. It's a technology that's used to locate people and or things indoors in real time. It's an active tracking solution where either wearables and or physical tags are assigned to either patients, assets, or staff. RTLS technologies can provide a variety of location accuracies. The location accuracy really that's required is really dependent on the use case that's trying to be supported by RTLS. And the location accuracy can vary from zone, meaning a floor, a wing, or a section of a floor, down to room, subroom, bed, or bay level. And that location accuracy is in context. It doesn't just tell you where someone is, it tells you, RTLS can tell you how long they've been there, and if there are other people or things that are also tagged with either badges or tags, it tells you the information in the context of those people and things as well. In addition, RTLS tags or badges can be equipped with buttons, as I said, that can help initiate a series of activities, whether it's alerts to let people know that help is needed, or they can be used to initiate a series of workflows, or to define the disposition of, for example, a piece of equipment. A button could be pressed to define that that piece of equipment is dirty and is in need of being cleaned. And Stephanie's going to show a lot of these examples as she starts talking about the software application that sits on top of RTLS, ZulaFly, and the workflows that can be supported. So when you start thinking about behavioral health environments and the use cases that I've described, whether it's staff, patient safety, and or rounding, there are some very specific attributes that are required in order to ensure that the staff is getting the help they need and that the workflows that are being initiated and executed in a reliable and consistent way. And the 6 attributes that I often think about are accuracy. Is the location information that's being delivered to ZulaFly accurately positioning the person, the tag, the patient in the right place? Confidence. You need to make sure that that tag position isn't jumping or hopping from one location to another. Speed, in that the tag location needs to be updated in a real time so that the relevant information is getting to the people that need it in a timely fashion. Uptime, if you're relying on your RTLS solution for staff or patient safety, you really need to have the maximum uptime of your system to ensure that it's always working as needed when needed. Many behavioral health and hospital environments are healing environments, and so you want to make sure that the aesthetics of your technology is blending in with that healing environment, and that you're not littering your ceilings with excessive equipment in order to deliver the right level of accuracy. And then maintainability. These technologies are intended to help streamline workflows and reduce burden on healthcare facilities. So you really need a technology platform that's easy to maintain, that doesn't need to have continuous tuning, and really is a set it and forget it solution. So I'll talk about Sonitor's approach to RTLS because that's the one I'm most familiar with. We leverage ultrasound as our core positioning technology, and ultrasound really is a technology that allows you to be confident that you're getting the highest level of accuracy down to room and sub-room levels, and those are accuracy requirements for staff safety solutions, and we'll talk a little bit about that. So the way the Sonitor solution works is there's a location transmitter that you see on the left-hand side of the screen that's installed on the ceiling or on the wall. It sends an ultrasound signal to the tag, the badge, or the wearable. That ultrasound signal is received, and that signal is then communicated over the facility's Wi-Fi to our server, and then our partner ZulaFly takes in that positioning data to their software application and then provides the visualization and the rules that are associated with either a button press or an activity that then gets displayed in their software platform. We use the facility's communication Wi-Fi only to carry our tag message. There's no burden on the Wi-Fi, and we don't use up a lot of the bandwidth. The tags receive the ultrasound signal, and as they move from one location to another, they update their location within 1 to 3 seconds. If the tag doesn't move, it basically goes into sleep mode, but it will send a heartbeat once every 5 to 10 minutes just to remind the technology that the tag is still there and that it's still sitting in that exact location. When it moves from one location to another, then it will update its new location within 1 to 3 seconds. So what are some of the benefits of ultrasound for RTLS, but also specifically for behavioral health settings and staff safety and patient safety applications? Well, the first is that ultrasound waves are contained by walls and windows, meaning that tags or wearables or badges really can be positioned down to specific room level locations. So because the signal is contained by walls and windows, there is no risk that that signal is going to bleed through or pass through walls or glass, potentially positioning the tag in an incorrect location. In addition, with ultrasound, there's no interference risks. So ultrasound is not affected by lighting, has no line of sight limitations, and it also doesn't interfere with any other electronic equipment. And the last attribute of ultrasound specifically is that it's fully and easily scalable. One of our differentiators is that a single location transmitter that hangs in the ceiling or hangs on the ceiling can be used to create up to 4 unique zones. And it does this by creating ultrasound virtual walls without the need for any other physical equipment. And that signal that's created by the ultrasound within these 4 zones is contained within those 4 zones and will not hop across the virtual walls. And that's a little bit of what you can see down on the right-hand side. I apologize, I see that the one on the far right is a little fuzzy, but these graphics are meant to demonstrate how a single location transmitter can create up to 4 unique zones by creating these virtual walls that are based on ultrasound and not based on other physical infrastructure. What we've experienced and what our customers have experienced is that other technologies can't consistently and accurately provide room level positioning, which in behavioral health and in staff safety and patient safety use cases can really put your patients and your staff at risk. And the reason that some of these technologies can't provide or guarantee room level accuracy is that there are inherent properties that are associated with these technologies that provide limitations. So with IR-based solutions, it's a known fact that there are interferences from light, things such as natural light, fluorescent light, and even light reflecting from floors and in-room monitors. In addition, IR technologies require line of sight. So think about if you're using a remote control to change your television channel. If someone stands in front of your remote control, that signal to change the channel doesn't get through to your TV. Similarly, in IR-based solutions, they require line of sight in order to receive the accurate location. So there are inherent challenges associated with IR-based solutions that necessitate the need for additional technology to ensure that signals are either blocked or masked to achieve optimum performance, which then means the need or the requirement for multiple devices in order to ensure room or subroom level accuracy. So we've seen environments where a single location transmitter from Sonitor is required to provide a certain level of coverage, and IR-based technologies can use anywhere from 2 to 4 times the amount of infrastructure to try to deliver the same level of coverage. So there's a cost implication, there's an accuracy implication, and there's an aesthetic implication, all associated with using non-ultrasound based technology. Other technologies that are being used for indoor positioning include BLE and Wi-Fi. And part of the challenge with these technologies is that they were really designed for communication, not for locationing or positioning. And if you think about both Wi-Fi and BLE, even in the context of your everyday life, those technologies are designed to go through floors, walls, and ceilings. Think about how your Wi-Fi in your healthcare facility, can be used throughout the facility by leveraging your access points. So those technologies, although can be used for certain applications from an RTLS standpoint, really are not designed to guarantee the room level accuracy that you need for use cases such as staff safety, patient safety, and rounding. In the example that I'm showing here, let's imagine a scenario where you have a staff member in a room and they press a button. As a result of ultrasound being contained in that room, the location accuracy is provided at room level. And because the signal is contained, you can be confident that your emergency responders are going to be able to find you and pinpoint your exact location as a result of that. On the right-hand side, I'm showing an example of potentially what could happen with either BLE or Wi-Fi as a result of those signals bleeding through ceilings, walls, and floors. Location accuracy for BLE and Wi-Fi has been able to get down to somewhere just over a foot or 2 feet. But if you think about the fact that walls themselves can be less than a foot wide, you can imagine that if that button is pressed in a room that's only using Wi-Fi or BLE for positioning, depending on where that caregiver is standing, that signal might register on the floor above, on the floor below, or the room next door. In a use case such as staff safety, you really can't run the risk that the location accuracy for your staff member is not guaranteed at room level. So it really is a consideration as you start thinking about the use cases that you're deploying an RTLS system for. So how does RTLS work in a behavioral health environment? A location transmitter is attached to the ceiling or the wall, depending on the configuration of the room. As I mentioned, that location transmitter will send out an ultrasound signal once every second. That signal is then received by the tag that's either worn by a caregiver or worn by a patient. And that signal then is transmitted over the Wi-Fi to our server, and then that positioning data is taken in to ZulaFly. And then what happens with that positioning data is defined by the use case, by the workflow, by the button press, and the alerts that are associated with that. So what does the solution look like? We have a series of tags or badges for staff. A simple button press activates the duress call. Once the button press is initiated, the tag will continuously transmit its location via the Wi-Fi every 2 seconds, and then the LED will start to flash on the tag so that you know that the button press has been initiated. We also have a series of patient tags in behavioral health environments. It could be important to provide the patient with a tamper-resistant solution so that they're not able to remove the wearable, just so that they always have easy access to it. So we've designed a solution that provides a tamper-resistant wristband so that if the patient were to cut the wristband, an alert would be sent and staff would immediately know that the tag is being removed by the patient. And then lastly, for behavioral health environments, depending on the environment within the facility, we also provide vandal-proof covers that are designed to minimize the ability to tamper with the location transmitter that would be mounted both underneath it, that are also anti-ligature, ensuring a safe environment for your patients. So as I mentioned at the onset of a concerning event, if it's an RTLS enabled environment, when the button's pressed, a message is sent every 2 seconds until the alarm's manually turned off. And that's done by a series of button presses. So it's difficult to inadvertently stop the alert if in fact it is a serious event. And this is actually why accuracy is so critical, because you really need to make sure that that location is being defined in the right position for help to be able to arrive at the right place. Without RTLS enabled solutions, if a staff member were finding themselves in a threatening environment, in many of these behavioral health environments, there's a panic button that's attached to the wall that the staff member would need to press. But you can imagine if you're in a threatening environment, reaching that stationary button may be difficult. So a wearable really provides a level and a sense of security and confidence to caregivers that they can get access to help the minute they need it and exactly where they need it. So in summary, Sonitor and RTLS technologies can provide these discrete wearables so that patients and staff immediately get access to the help they need. As a result of our ability to provide room level coverage and sub-room level coverage with minimal devices, they're inconspicuous in patient rooms, which make it a less threatening environment for patients. And as a result of the accuracy, emergency responders or those that are required to get help to either staff or patients know exactly where staff and patients are at all times. And we can also define rules to help ensure that patients are also interacting appropriately either with each other and or with staff. So with that, Stephanie, I'm going to hand it over to you.
All right, thanks, Sandra. So what do we do now with all of this data that we've been collecting as staff move around, the button press from the tag? How do we provide efficiencies to staff specifically within the behavioral health facilities to allow them more time with patients instead of looking for assistance or looking for folks? How do we help? So what we're going to do is we're going to, in the next couple of slides, walk through the application and the dashboards. What do they look like? What data do they provide? How do alerts get sent? And really talk through that process of how the end user interacts with the system and the information that they receive from it. So this dashboard in particular has the ability to view up to 4 different maps. That could also include 4 different buildings. So the system is designed for an enterprise type deployment. So you can choose whether it's department, unit, or building to really maximize the information that you can see. You'll notice in the top right and the bottom left-hand maps, we have patients and or staff that have called for assistance. So the visual your eye draws to those maps, you see the red circle around the icon on the map, along with the red, the individual is shaded red within the legend. We do update and move those icons around the map in real time. So as they move, you will see exactly what is going on. There's also the ability to search within each of those maps. You'll notice within the top left-hand corner, as you were to start to search, any criteria that matches will be the options that are left in your list. Another way to take a look at some of that same information, but then add on alerts on top of that. When we think about staff safety or staff assist, the big piece of that is the alerting mechanism and how do we know when folks are in need of assistance. So this is another dashboard that provides some additional information, and we've broken this one up into 2 separate widgets. The top half are open alerts. You'll notice that they are based on priority, and each priority is assigned its own icon. Those with the highest priority rise to the top. The details of the message that you see in that column, that's the information that gets sent out. Folks will know exactly who has requested assistance and their exact location. And then duration is in the far right-hand column. Down on the bottom of this dashboard, I've inserted our staff list. So some of the things about the dashboards that make us a little bit different. Staff name can be anything that the facility is comfortable with or chooses for it to be. For privacy's sake, you may choose to have an employee ID. You may choose to show just initials. You also may choose to add additional columns. Department is very common. Are they part of a workflow that we should be aware of? This dashboard also updates in real time as staff move around. There's also a global search, which is up in the top right-hand corner of all of our dashboards. So at any time, staff can do a quick search and it will come back with all of the results that matched, showing all of their locations. The goal with the global search, of course, is to help with efficiencies around looking for people or things. We have the ability to also tag assets, and how do we save staff time with that? Staff safety, the big piece is alerts. How do we proactively help staff? Staff cannot be everywhere at once. So how do we provide additional functionality, helping them to be more efficient? And alerts is one of the ways we can do that. An unlimited number of alerts can be set up within the system. Those alerts can be sent to any communication device that you already may be using, or you may be utilizing a central alarm management system that the alert can be sent there and it will follow your same dispersal tree that you already have set up. Alerts have the ability to be set up with unlimited number of escalations. The whole goal is that that alert continues to be sent until action is taken, until somebody physically closes that alert. Programmable button presses on the tags. Sandra touched on this and it becomes really important. Those button presses can be programmed based on your role or staff type within the facility, and that alert can then be sent out to anyone, internal or external of your facility, to make sure that responses, somebody is responding to the request. Customizable alert messages, there is not a text or character limit on the message that gets sent, but there are a couple of items that make sense. The name of who's requesting assistance and the exact location. Any other verbiage that you would like to include, you absolutely can. The goal of that alert message is so that the recipient knows exactly what their action item is, what they need to do when they receive it. We touched on the priority that gets assigned to all of the alerts and that the highest priority rises to the top. But there's also the ability for PCs to play an audible sound. And that audible sound can be set up at a repetitive frequency too that you choose based on that type of alert. One of the questions we get asked frequently is around other types of systems that we integrate with so that we can, the visual of how do we know that something is going on. So strobe lights is very common, that alert can trigger a strobe light to go on. We also do get asked about integrating with video cameras, and can we see that real-time feed before we do send a staff person to that area. And then of course with alerts, we do keep all of the historical information. So all detailed historical reports on who requested assistance, staff response times, all of that information is stored and is available. Another aspect that might fit within your behavioral health facility is patient locating. You'll notice that the top half of my dashboard stayed the same, but I've swapped out the bottom half and put patients in place of staff. So a lot of flexibility within the dashboard and what I as an end user see. We can integrate with any EMR or EHR system and pull in those pieces of information that are relevant to you. I, as an end user, then can choose those columns essentially of the information I want to see. And the same concept then applies with the name. For privacy reasons, you may choose to use initials, MRN number, etc., and you absolutely can do that. One of the value adds of patients also wearing tags is that now you can utilize the caregiver time with patient and patient time with caregiver reports to understand interaction and the amount of care that is being provided. COVID is still on everyone's radar and something we're still talking about. So I did want to touch on contact tracing. Now that staff at a minimum are wearing badges and potentially patients, very easy for us to quickly understand interactions. One of the reports that we provide is the ability to choose the staff member that may have tested positive for conversation's sake, and then choose the interaction time. So in our facility, we may decide that 10 minutes is our threshold. Completely customizable, I choose 10 minutes, and it will come back with all of these staff or staff and patient interactions that staff member had for 10 minutes or greater, for how long, and their location. So it helps us understand who needs to quarantine, who should be tested, how do we want to triage potentially infected patients, etc. I've also got a screenshot of a bar graph down on the bottom right. I like to show this particular chart because it helps us as a facility quickly identify any trends. This one is around alerts. And we can see, are we seeing a spike in alerts on certain days of the week, certain times of the day? Do we need to think about how we're staffing differently so that we're making sure we're taking care of everyone within our facility? Staff rounding. Sandra had talked about workflow, and this is absolutely one of those applications that helps with that aspect and keeps everyone really efficient. The dashboard provides a really easy visual of what rooms need to be rounded. When was the last time this room was rounded on? And that rounding time frame is flexible. You may have one room within a unit that needs to be rounded more often. You absolutely can do that. You also can view multiple units in this dashboard. So going back to that concept of eliminating the constant clicking around to find the information that you need, you can set up multiple units within here. And staff are also able to view their rounding performance based on certain timeframes. So when we look down in the bottom left, we've got rounding averages, completed percentage, average minutes between rounds, just some nice additional information in case there's ever any friendly competition between departments. And then I just put in a staff list in the bottom right. By all means, you do not need to, but just a nice way if there are other staff members you're looking for, this is a real-time visual of where they're at. So we've talked a lot about alerts and notifications. How do we get them? Out of the box with ZulaFly, alerts can be sent via text, email, the mobile app, and also the pop-up within the user interface. So the screenshot in the middle, this is the verbiage that would be sent out to any communication device. That verbiage is customizable. You'll notice the priorities, the icons that we've talked about, and also that those with the highest priority have risen to the top. I know I've mentioned it and I'll reiterate again, the unlimited escalations is extremely important when we talk about staff duress deployments. Part of the project process that we work through with all of our customers is understanding what their normal process is today. How do they receive alerts? Who should receive them? What's the time frame that you want between each of those to get sent? So there's a lot of conversations, but there's also a lot of flexibility so that the system can be set up to function exactly as you would expect. So common question that we get asked, and Sandra spoke to this really well, which is now that we've put in this infrastructure, how do we continue to utilize this and really easily add on additional applications. Asset management or asset locating. So you may too have, even if it's a handful of pieces of equipment that you spend way too much time looking for, now that this infrastructure is in place, let's go ahead and put tags on those pieces of equipment and save staff a ton of time from looking for them. We've talked about staff safety, environmental monitoring or temperature monitoring, not only medication fridges and freezers, which is the easiest and most common deployment, but also the ability to take in and display differential air pressure, CO2, humidity, and any other pieces of environmental monitoring data that you want to collect can be displayed and alerted on. Workflow. We sometimes think about workflow in a patient and door to door, where do they spend their time? But we also can think about workflow in sterilization of equipment, for example, or workflow around staff rounding. So different applications utilizing the exact same infrastructure and technology so that you too see the value in the deployment. This one also highlights a lot of the common questions we get asked about the flexibility of our platform and the ability to pull in data. I touched on it with EMR and talking about what are the pieces of the patient record that would be beneficial to see within ZulaFly. That information can not only be pulled into ZulaFly, but also pushed back out if it's relevant. Active Directory, very common, so that it makes it easy for staff to log into the system using the same credentials they do for many other systems throughout the facility. So what are the differentiators when we think about other applications that are on the market? The customer gets to choose and really customize their implementation. And what I mean by that is the information that's displayed within the dashboards. We don't have a concept of hard coding of fields that you have to have. So when it becomes your verbiage and the information that you have chosen, we tend to see very consistently staff ramp up time is much quicker. Training is much shorter because it's all of the information that makes sense to them when they log in. All of the applications are housed within a single user interface. So as you come back around and maybe add asset locating or temperature monitoring, those dashboards and reports now just become available within the same interface that staff have been using. Customizable dashboard view. We looked at some of the options. Those are tied to each individual user ID. There is not a one size fits all that everybody in our facility will be looking at the same set of information. So you within your role, set up your dashboards for the information that's relevant to you. How do you maximize your screen space? So that is driven by user ID. And then we offer a cloud hosted or an on-premise solution. Most of our customers are deployed in the cloud. It's a nice web application, very easy to install, support, maintain. So we have seen a nice trend in that direction. And then my last bullet point is the unlimited alerts and the ability to set up unlimited escalations that can be sent to any communication devices is really key when we talk about staff safety deployments. And with that, Jennifer, we'd like to open it up for questions.
Thank you both so much for a great presentation. As a reminder to our audience, if you have a question for Stephanie or Sandra, please use the questions feature on the webinar dashboard to submit your question. We do have some questions that have come through already, and we'll start with those. Our first one is, how quickly can this solution be deployed?
So Steph, maybe I can start on the infrastructure side. So we go through a very, I'll call it simple process. We sit down and as a team with And in collaboration with ZulaFly and the end user, we talk about what the use cases are and then define the coverage from an infrastructure standpoint based on the use cases. After those discussions, we hand it off to our internal designer, who then designs the floor plan based on the use case. We verify that we've got the right coverage. That typically happens within a couple of days. Once the decision's been made and the customer has signed off on the design, from an implementation standpoint, it does depend on the size of the facility. But we can get a small facility, call it 50, 75 beds, up and running in less than a week. A little larger might take a little bit longer, but because the technology is easy to deploy and easy to set up, we have two flavors, if you will: a battery operated set of location transmitters or power over Ethernet, and which device is chosen is often dependent on whether or not we're implementing in an existing facility. If it's an existing facility, often that facility prefers battery operated so that there's no disruption to patient rooms or to patient care. So I would say from a hardware standpoint, anywhere from a couple of days to a week, maybe a week and a half, depending on the size of the facility.
The nice part about the software then is that we are having conversations and gathering data while the hardware is being deployed. So the way it typically works out is that as soon as the hardware is ready to go, so is the software. So we can definitely be doing things in tandem.
All right, our next question is, can the buttons on the staff badge be programmed?
Yes, and all of our staff safety, staff duress customers do that. The value add is the staff type, depending on your role, can be programmed differently than others throughout the facility. And those button presses can be sent, the alerts from the button press can be sent to anyone internal or external of the facility.
And the Sonitor tags, the two, we have 3 form factors. 2 of the form factors each have 2 buttons, which allows you to program or define up to 3 activities for each tag. So there's an A button that can define a specific activity or workflow, a B button define a separate activity or workflow, and then pressing the combination of pressing both buttons can allow you to define a 3rd activity or workflow. And depending on the use case, those buttons can also be, I'll call it, inactivated or not programmed, so that if you don't want button presses to either initiate workflows or alerts, in some cases in a patient environment, you might not want the button press to initiate an alert or a call. You might just want to use the patient wearable as a technology to be able to locate patients versus allowing them to press buttons, and those button presses can be deactivated.
All right, our next question is, can staff alerts be sent to any device?
Yes, so out of the box, alerts can be sent via text, email, the mobile app, pop-up, other common devices, Vocera, SpectraLink, pager. So any communication device that you are already using, we can tie into and send those alerts to.
Our next question is, how easy is it to add on additional applications?
So from an infrastructure standpoint, if the use case, for example, that we talked about is staff safety, staff duress, the technology that is deployed is the same technology that would be used to support additional use cases. So from an infrastructure standpoint, if the facility is looking to ensure room level coverage for staff safety, there would not be any, or I would say insignificant additional infrastructure that would be required. If additional use cases such as patient safety or patient locationing or asset locating or asset management are the use cases to be added on, there would be additional tags that would be required. But from an infrastructure standpoint, little, if any, new infrastructure would be required.
And then on the
Are
software,
there, sorry.
and on the software side, we just add back that functionality within our admin section, and very easy.
Great, thank you. Our next question is, are there different levels of permissions to ensure privacy and security of staff?
Absolutely. So besides that, most commonly we tie into Active Directory, we also have permission profiles. Very important. And they typically break down from the majority of the staff that are logging in to do a search, understand rounding and where they should go. And then we typically see another group that has access to reports and a smaller group then that has access to admin. But yes, absolutely, privacy is extremely important.
All right, our next question is, can you speak to the ROI with this type of solution within behavioral health?
So maybe I can start, Steph, and then you can jump on. So there are a number of factors to consider when you're thinking about the ROI with any RTLS deployment, some of which are tangible, some of which are not, or are intangible, right? So from a saving time standpoint, those are productivity gains. From a saving step standpoint, those are productivity gains. But if you think about hard dollars, there are a number of costs that are potentially associated or can put your facility at risk. There's medical costs that are associated with every incident if a caregiver or patient or anybody in the facility gets hurt. There's a turnover cost. So if the caregiver does, turnover cost in that if staff don't feel safe and there are a number of incidents, you may lose staff. So you've got turnover that you need to worry about. If a caregiver or someone in the facility does get hurt, you need to cover their shifts. So there's overtime and temporary staffing costs. If there is injury, there's medical treatment and workman's comp costs. There could be fines that are associated either from OSHA or specifically from state. And then the worst case scenario, there could be litigation costs. So we've calculated the ROI based on single incidences or multiple incidences to be anywhere from a couple of $100,000 to $500,000 to millions of dollars, especially if there's litigation. And we do have an ROI white paper on our website that covers not just staff safety, but it also covers the variety of use cases that are supported by RTLS. So if you go to the www.sonitor.com, you can find the ROI document there.
Thank you again, Sandra and Stephanie, for your time today and for a great presentation. I would like to encourage everyone to visit today's sponsors to learn more about the services they provide to our industry. Please visit ZulaFly.com and Sonitor.com. A quick reminder that you can obtain your continuing education certificate by completing the post-webinar survey. The survey will be emailed to you 1 hour after the end of today's webinar. You must complete the survey to receive your certificate, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar. please visit webinarwednesday.live for more details and complimentary registration. Thank you all and have a great afternoon.